Welcome to our Community Health Assessment Project on Catawba County, North Carolina. This presentation was brought to you through the collaboration of 5 amazing RN to BSN students: Heather Richards, Whitney Shelton, Kendall Stacy, Mandy Watson, and Mary Welch. Here we see a closer map of the approximate 400 square mile tract of land in the western Piedmont region of North Carolina known as Catawba County. And within it are the major townships and communities: Brookford, Catawba, Claremont, Conover, Hickory, which is also 4 smaller communities within it, Longview, Maiden, and Newton. The following slides will show our data analysis of the county along with our windshield survey. Here we have the recent Catawba County statistics of population broken down into gender, age, and ethnicity. You'll notice that 22.6% of people in Catawba County are teenagers. That means there's over 35,000 people in this county of small towns and rural land that are under 18. Approximately 15,000 of the general population are Hispanic and have a significant disadvantage culturally due to language barriers and economic resources. We did take notice of this demographic and investigated further as a potential health problem. This additionally shows that Catawba County does not have the most wealthy of residents. There are more low to middle class families, and the poverty level, especially as it relates to children, is very significant here. It illustrates the significant financial need that exists and the disparity among the Hispanic population, because 46% of the population are Hispanic and in poverty. Where poverty exists, health disparity usually roams. The county seat is maintained in Newton. That's where you have a picture here of the county courthouse. The population is very diverse. It has within it not just the Caucasian population, but Hmong, Hispanic, African American, and Vietnamese. There is a strong public transportation system that does maintain within the city limits, of course, private vehicles, and there are also pedestrian sidewalks and bicycling lanes in the town. Most of the housing is low income unless it's been more recently built. There are many Christian denomination churches that are represented in this town: Methodist, Lutheran, Baptist, and Pentecostal. And because of its diverse population, the town also has an eclectic mixture of ethnic restaurants and businesses. Here in Newton, we also have major employers of Target Distribution Center, Flowers Baking Company, Lee Industries, General Dynamics, ZF Limforder, Starstead, Technobuilt, Renwood Mills, Catawba County Government, and Catawba County Schools, as well as the Newton Conover City Schools, are all the major employers in this area. The major highways, which there are 5 that run through this area, are I-40, US 321, US 70, NC 10, and NC 16. Norfolk Southern Railroad operates through this area, and the local airports in Catawba County are the Hickory Regional Airport, which is just 12 miles from Newton, and Charlotte Douglas International Airport in Charlotte, which is about 38 miles away. These are some more sites in Catawba County. The sign on the left is from one of the shopping centers in Newton that primarily caters to the Hispanic population. As you can see, there are many stores and restaurants within there for that population. On the right is a sign for one of the parks in Catawba County, Baker's Mountain Park. That is located in the Mountain View area of Hickory. Maiden, North Carolina is a cute little small town in Catawba County that actually straddles the border between it and Lincoln County. There's a small town feel here, as well with the open park and town hall, the small police station and library, fire department, and there are many churches as well. Downtown Maiden is home to many unique shops and family-owned businesses. Unless you're in town, most homes are rurally based and low middle income. This particular area is not as diverse as most of the population is predominantly Caucasian. Claremont is a small little town. As you can see, it only has about 13, 14 hundred people in that, and it is a very small area, maybe 7 square miles, close to that. But within that, there are 3 public parks, and it also has a lot of the major interstate and highway intersections. But there are, of course, no formal transportation unless you have your own car. But it is a primary area for industry. There are several plants, 3 of which are HSM, Prismian, and Comscope. There are a few fast food establishments, laundromat, car wash, gas station, and family-owned businesses in town. And there are Lutheran and Baptist churches as well. Most of the homes in town date back to the 1900s, early 1900s, and some of them are from the 50s, and they're the mill house variety from when the area was very big in textiles. Even with all these businesses around, the socioeconomic status is generally low to middle class. While this area is predominantly populated by Caucasian families, there is also a strong representation of African American and Hmong families. Hickory, North Carolina is probably one of the more popular areas in western North Carolina and one of the more popular cities in Catawba County. It's known for its furniture manufacturing, and it is home to Catawba Valley Community College and Lenore Ryan University. One interesting cultural fact that we learned about the downtown area is that there is a place called the Salt Block, and what it is science, arts, and literature together. And in this one area of downtown, there is a library, a science museum, an aquarium, planetarium, educational wing, arboretum, theater, and an event space. Sounds like a very neat area to visit. Highland area is very near downtown, and sadly, it is the lowest income neighborhood of Hickory, and crime is very high. This is also where the Section 8 housing is held, and as a result of that crime being high there and it being very close to downtown, sometimes that crime does spill over to downtown. Many businesses did leave this area, but now the City Council has been trying to revive the area. It does have mass transit via Greenway, along with bicycling and driving as the primary modes of transportation in the Highland area. There are a larger number of Hispanic and African American residents in the Highland area, more than any of the other parts of the county. This is also where, in Hickory, the Catawba County Health Department is based. We also have social services and the Fry Regional Medical Center. Most of the services for anyone needing maternity care are going to be in this region. The YMCA has all the typical services that you would expect for healthy living and for daycare at a typical YMCA, but this particular YMCA of Catawba Valley has a interesting program known as the C.O. Miller Teen Center that reaches out to the young people, and they help with everything from homework to promoting healthy living. It is a unique program for Catawba County and the first of its kind in the region that specifically is geared towards teens as they mature into adulthood. As you recall, the large population of teens, between 20 and 30% in this county, so this teen center is a valuable community resource. Teens, especially from lower income or single parent families, are very high risk for serious health concerns So this is a very wonderful community resource that this county has. The NC Child Health Report Card is where we learned some startling facts as we dove into the problems of poverty due to and the large teen population. Um, we learned that there's the potential that teen pregnancy, especially among Hispanic teens, is one of the reasons why there is such a poverty level there. Teen pregnancy rate nationwide has reportedly dropped in recent years, but it's still a significant health concern, as we learned here with the North Carolina Child Report Card. It tells us that teens who have babies are more likely to live in poverty, less likely to receive prenatal care, and less likely to complete education that could lead to employment and could pull them out of poverty. It is a significant health concern, especially in the Hispanic population of Catawba County, where these teens are 3 times more likely than Caucasians to have babies. The teen pregnancy rates that are here are broken down by ethnicity, and it is a goal of the North Carolina Health Department and legislature to decrease teen pregnancy by 30% in 2020. So we're getting all of this from the Community Health Assessment of Catawba County from 2015. So as we know, the risk is high for teen pregnancy to continue for those persons affected in a downward spiral towards school dropouts, incarceration, and adult unemployment. The North Carolina House Bill 88, the Healthy Youth Act, passed in 2009 and is a piece of legislation that serves as a primary prevention tactic requiring North Carolina schools to provide age-appropriate sex education beginning in the 7th grade. Catawba County schools previously only taught abstinence as a method of sex education. Now, however, it includes comprehensive viewpoints, including teaching on contraception, STDs, and dating violence. And parents can opt out of these, but the legislature is still hopeful that the message will get through to the students in the schools and filter on down, and that this will affect the rates of teen pregnancy, STDs, and dating violence and reduce those as is their goal. So our windshield survey and secondary data analysis found these strengths and weaknesses within Catawba County. The strengths of the close-knit community and plenty of elder support. There are also a significant number of older persons in the county. The fact that there are such great community services like from the YMCA and other maternity services that we're going to talk about. And there are these emerging programs in schools and organizations, as we said, to benefit the teens, and that there's an awareness that there's a problem, because if you don't know there's a problem, you can't fix it, but they are aware and they're working towards a solution. The weaknesses that are still there, as we mentioned, it's a very diverse population, not just with the Hispanics, but with the Hmong, Vietnamese, and other ethnicities that are represented there. There are some language barriers. Poverty is not something that goes away very quickly. All of that results in health disparities and lack of education. So there's still a lot to work on, but there's a lot of positive as well. So we decided as a team that we were going to focus primarily on the Hispanic teen population and the pregnancy issue with teens because of the long-range effects on the community as a whole. So this is the Pregnancy Care Center of Catawba Valley, and we did our stakeholder interview by telephone with Jan Shores, RN, who is the Assistant Nurse Manager of the Pregnancy Care Center of Catawba Valley. This facility is located in Hickory. It is a faith-based nonprofit organization that does not require any cost for their services. They provide Spanish-speaking advocates and workers that help with that population. And they offer all levels of prevention services for women, such as pregnancy testing, ultrasounds, pregnancy option education, educational classes, community referrals. They provide supplies for baby needs and maternity and infant clothing. And they also provide abstinence education. So you can see they've got the prevention, the secondary, and the tertiary prevention levels all covered there. They also refer to private offices in the area that have midwives that can help with child delivery. They go send people to the Catawba Valley Maternity Services as well, and they receive referrals from the health department, doctor's offices, and local schools to help with their needs, with the needs of the teens that are pregnant and just women in general. It's a very vital organization in this community. So as we mentioned, the Catawba Valley Maternity Services, this is an example of one of their exam rooms in their lab area where they do provide care for these teens and young mothers, and they are focused also on all levels of primary prevention, secondary, and tertiary prevention, and they also provide pediatric care. This is one of the maternity services that they have for these teen mothers. This is a breastfeeding and parenting class that they're actually in this picture having a baby shower for all of these new moms, and this was found on their Facebook page. But the community program establishes peer-to-peer support, fosters community support, and they are able to really try and make improvements on their lives and make better choices and provide for their needs. So education and promoting awareness are components of every level of prevention for teen pregnancy, because there's a need for sex education to prevent pregnancy, and then if or when it occurs, to help through the prenatal and maternity process, parenting, prevention of subsequent pregnancies, completing educational goals into adulthood, and job training. It's such a huge task that can seem overwhelming, but it is very vital to have a thriving community. And ways that other people can help that the nurses in the community can promote are people to help with volunteering, help with funding, and administration of those services. This, as we mentioned, having peer-to-peer mentoring programs within the community organizations where services are being rendered are very important, because it's quite established fact of mentoring that people that have been through an experience can help another person through that same or similar experience. So perhaps teens can receive help from mothers and fathers that were teen parents, and try and make those experiences less frightening and help prevent these problems from continuing on. The CDC, according to our research, declared that teen pregnancy was not only a public health priority, but a battle that they feel like can be won, and it is won through the combined efforts of our nation's communities. And you can only start at home, and North Carolina is our home. And this is one of the things that we are going to be taking with us into our own communities and into our homes to help teach and promote awareness and health. So we thank you for joining in with us in our learning about how we can work to make our community stronger and healthier.